Question 1. A unique provider identification number is required for all healthcare providers, established by HIPAA Administrative Simplification Standard. The term for this number is Option A, Medicare Standard Number. Option B, National Provider Identifier. Option C, Certification Number. Option D, State Licensure Number. The correct answer is option B, National Provider Identifier. The National Provider Identifier is the standardized unique identifier adopted under the HIPAA Administrative Simplification provisions. It is a 10-digit identifier used by covered healthcare providers in HIPAA standard transactions. It is separate from state licensure, certification, and payer-specific identification numbers. Extended rationale: the correct answer remains B, National Provider Identifier. To understand this question in greater depth, begin by identifying exactly what concept, clinical principle, developmental theory, nursing action, physiologic process, or professional judgment the STEM is testing. The most important step is to connect the decisive information in the question with the defining characteristics of the correct response. The best answer is not merely an option that is generally associated with the subject. It must be the choice that most precisely explains or addresses the particular facts presented in the scenario. The alternative choices should also be considered carefully because nursing and professional examinations frequently use distractors that are related to the same general topic. An incorrect option may describe a real concept, but it may correspond to a different developmental stage, symptom pattern, physiologic mechanism, priority level, therapeutic approach, or clinical circumstance. A useful strategy is to ask what additional or different facts would need to appear in the STEM for each alternative to become correct. If those defining facts are absent, the option can be eliminated even if the statement itself sounds familiar or medically relevant. Understanding the reasoning behind the answer is more valuable than memorizing the answer letter. In nursing practice, assessment and intervention depend on interpreting the whole clinical picture, including the client's age, behavior, symptoms, history, current condition, safety needs, and response to the environment or treatment. Theoretical and physiologic knowledge provides a framework for interpreting those findings, but it must always be applied to the actual situation described. This same principle helps on examinations because a question may test the same underlying idea through several different patient scenarios. For test-taking purposes, use a structured approach. First, determine precisely what the question asks. Second, identify the strongest clue or combination of clues. Third, connect those clues to the relevant principle, and finally compare each option against that principle. Do not add facts that are not present in the question, and do not select an option simply because it contains terminology associated with the topic. Following this process confirms B, National Provider Identifier, as the best response. The original rationale above provides the central explanation, while this expanded reasoning shows how to recognize the concept, distinguish it from the distractors, and apply the same knowledge confidently when a similar question is presented in a different form.